When you're working with clients who have gone through chemotherapy, or if you yourself have gone through chemotherapy and or are diabetic, you may suffer with peripheral neuropathy, the burning, tingling, numbness of the hands and feet and fingers and toes. And it can be quite debilitating and painful. One of the things that it can affect is balance. And with the higher risk of osteoporosis, also from cancer treatments, you really need to work on your balance in addition to strength training and strengthening your bones, increasing your bone density, so that if you should trip or fall, you have a much greater likelihood of regaining your balance and not getting injured. So I want to show you just a very simple balance progression that you can do on your own or with a certified cancer exercise specialist, starting with just standing. And how well can you stand on both feet, keeping the feet going forward, knees, thighs, everything is in alignment. If you can do that, no problem. Then we're going to go to one leg. Use the chair for support, and notice if your knee starts to buckle, if it caves in or goes out to the side, or if you notice that your ankle is wobbly on either side, okay? So you can compare one side to the other, and if there is ankle instability, I'll cover that in another video that can help you strengthen those ligaments and tendons, supporting your ankle and protecting you if you ever do lose your balance. Okay, so if you did that with ease, we're gonna just move this out of the way. And I know not everybody has a BOSU balance trainer, but this is such a wonderful tool or piece of equipment that you can use for balance. Now I'm going to bring my chair back a little bit, because if you're ready to move to the BOSU balance trainer, you're going to first start with something for support, and we're going to go through the same process where you find that center, kind of the bullseye, and you can lift your leg up entirely, or you can just go to your toes, so kind of like a kickstand. And then you can try that on the other side as well. So if you lift your leg up and you're very unstable, then use the kickstand. And if you can do either of those with no problem, then we're going to go ahead and simply get rid of the chair and go back to balancing with no support. The next step from there, of course, would be to balance on one leg. And you can see it's much more unstable. And I like to consider myself pretty good at this, so that tells you a lot. Most people will not be ready for this. But this is a nice progression, and you can go back as needed. So sometimes it's going to be a step forward and a step backwards. That's okay. Just keep trying, keep plugging away, and it will get better with practice.